Hello and welcome back. Today we're going to be discussing the due meridian. It originates at the lower abdomen, emerges in the perineum. Due 1 runs posterior along the midline of the sacrum and the spinal column of due 16. Due 16 enters the brain where it makes this nice little feedback loop. Due 16 enters the brain, due 20, which is this whole little loop right here, descends the midline of the head, bridge of the nose to the philtrum at due 26. It terminates at the junction of the upper lip and gum. You notice how all that's bolded? The chances of you getting a test question on your quiz or on your final is really good, actually. Whenever you see a highlighted different color compared to everything else or a bolded statement, I guarantee that's what you're going to be tested on. So the diamide primary channel, the master point is SI3, the coupler point is UB62. Now it's very interesting. The 8 extra channels work as a lock and key mechanism, which means it's a combination lock. If you do SI3 first, followed by UB62, it tells the body that you want to gain access to the due meridian. Okay? So all the 8 extras has a master and couple point. If we do UB62 first, followed by SI3, it's going to open up its paired 8 extra meridian. Okay? Now, you're going to learn this when you get into DTX, the pediatrics class, and that is the 8 extras are formed once the cell gets fertilized and it begins to divide. It divides 8 times. Each time the cell divides, it's the emergence of one of the 8 extra. Ren, Du, Chang, Dai, Yin Wei, Yang Wei, Yang Chao, Yin Chao. Okay? Each time that cell divides, an 8 extra is formed. Now when you're born, the 8 extra channels do all the heavy lifting. And it does the heavy lifting and it gives time for the body to develop. And as it develops between age 0, when you're born, to a couple years of life, that's when the channels stretch from the fingertips to make the foot part of the channels. Okay? And then by the time you get to age 7 in women or little girls and age 8 in boys, that is all set. And then the 8 extras move into the background to be the reservoirs in chi and blood. And then the primary system, the low system, the divergent system, the tendomuscular systems all take precedence. The 8 extras are moved to the background. Okay? The low point is due 1. Crossing points is Ren 1 in UB12. Pathologies of the primary channel is stiffness, pain in the spinal column, headache, and epilepsy. Okay? The first branch originates in the lower abdomen, descends to the genitals and the perineum, wraps around the anus, ascends to the interior of the spinal column, and then finally enters the kidneys. Okay? What they're alluding to is you can actually add chi to the kidneys by adding moxa or needle to due 4, which is at the same level as UB23, the inner shoe of the kidneys. And so you can actually feed that battery, if you will, and help build up the jing of the body by moxa due 4. We'll talk about that here in a second once we get to actual due 4. Second branch originates at the lower abdomen, winds around the external genitalia, ascends to the middle of the umbilicus, passes through the heart, ascends to the throat, winds around the mouth, ascends to below the middle of the eye. So here's another channel that goes to the eye system. The third branch emerges at UB1, follows UB channel bilaterally along the forehead. Bilateral branch meets the vertex, enters the brain. A single channel emerges at due 16, divides again, descends through UB12, and goes along both sides of the spine into the kidneys. Okay? The Du low connecting arises from Du 1, ascends bilaterally along the sides of the spine, the nape of the neck. At the scapular region, it connects with the UB channel and threads through the spine. Spreads over the occiput. Okay. What this is implying is it has a really good area of influence. Not just back, but also head and neck issues, vision issues, can all be treated with the Du. Okay. The pathologies of the Du low connecting channel: Shu symptoms, heaviness of the head, tremor of the head. Sure symptoms, stiffness of the spine. Which leads us to Du 1. Du 1 is on the midline, midway between the tip of the coccyx and the anus. It's the low point of the entire Du channel. It treats hemorrhoids, benefits the Tu lower yin, activates the channel, alleviates pain, and finally calms the spirit. Now, what's interesting about this is what that phrase benefits the Tu lower yin actually represents. In classical Chinese medical language, we refer to the opening of the anus and the urethra, or the vagina and the anus, as the two lower yins. Okay, so that right there tells you it has an effect on the tissue, both external genitalia and the anus itself. It's one of the #1 points for a prolapse rectum. The other one would be D20 on the top of the vertex. It also has a very strong ability to affect low back pain because of the predental nerve system. Okay? And really that whole nerve, when you tap into that nerve, is really the ability to treat the hemorrhoids, to pull it back up. Okay, now we're leading into Du 2. Du 2 is on the midline in the sacrococcygeal hiatus. It benefits the lumbar regions and legs, dispels when damp. That's it. It's a really good point for hemorrhoids when you can't actually do Du 1, the patient doesn't feel comfortable doing that, or if you need to treat epilepsy. It's one of your go-to points for epilepsy. Okay. Du 3. Du 3 is in the middle of the spine, in a depression below the spinous process of the fourth lumbar vertebrae. Dispels when damp, benefits the lumbar region and legs, regulates the lower jiao. This is one of your go-to points for muscle impairment, numbness of the low back or the legs, muscle atrophy of the low back, pain in the lumbar sacral region, or impotence in men. Du 4, LifeGate. Okay, now the reason why that's highlighted is because it's a mnemonic. That means it's the battery. On the midline of the lower back, in a depression below the spinous process of L2. This is that level of UB23, the back sheet of the kidneys. It clears heat, regulates the entire Du mine, tonifies the kidneys, benefits the lumbar spine. Now it's interesting what that term means, benefits the kidneys. When we get kidney deficient, that usually also implies that there's some type of Jing deficiency. So Du 4 acts as a back door or gate in this context. If you needlehead moxa, you can feed that moxa energy into the kidney systems to slightly boost up the kidneys, but also Jing itself. Okay, that's super important to understand that. Okay, then we move into Du 5, which is L1. All these are directly up the spine. Okay, the trick with this is figuring out which which spinous process does not have a dew point. And that's something I'll actually write on the board tomorrow when we're in class to help you. Okay. Dew 5 benefits the lumbar spine, regulates or benefits the lumbar or lower jaw. Sorry, benefits lower jaw. That's it. That's all this point does. You're really only going to use this for the lumbar spine. Any spine pain stuff. That's really the only time you ever use Dew 5. Dew 6. Dew 6 is the lower border of T11. It fortifies the spleen and drains damp. In fact, it's a very strong point to fortify spleen. It's really strong in treating jaundice, diarrhea, and pain in the epigastric region. Okay. The way I remember this is sometimes when you have gallstones, it's not just about treating the gallbladder. You get that referral pain of the epigastric region. You need to remember that maybe you need to add Dew 6. Okay, so that's worst case scenario. Extreme pain caused by gallstones. Dew 7. Dew 7 is the lower border of the spinous process, T10. Boom, right there. Benefits the spine, benefits the Miller jowl. That's it. That's all it does. Dew 8. T9, lower border of T9. Now, if you remember the name, which means or translated as sinew contraction, it will help you remember that it has an affinity or an action of soothing the liver and pacified wind and relieve spasm. Okay, hence the name, the sinew contraction. That spasm. That's Dew 8. Dew 9. Dew 9 is T7, which fortifies the spleen, drains dampness, and regulates the middle jowl. It also treats jaundice. Dew 9 is one of the strongest points to treat jaundice. Okay? It also unbinds the chest. Dew 10. Dew 10 is T6. Alleviates cough and wheeze, clears heat, and detoxifies poison. There's only 3 points in the entire acupuncture system that detoxify poison. Dew 10 is the first one. Gallbladder, that you're going to find out in points 3, gallbladder is the second one. There's a gallbladder point that also clears heat and detoxifies poison. It's gallbladder. Dew 10 and a gallbladder point detoxifies poison. Now, that brings up a very interesting proposal. Are we implying that we could treat something like snake poisoning or snake bite with these 2 points alone? No, that's not what I'm implying. I'm implying that it helps detoxify poison. Worst case scenario is if you get bit by a snake, you need to go to the hospital and get antivenom. Do not rely on acupuncture alone to help you. However, I met a student a while back who was a Christian missionary in Vietnam, and his teacher taught him these 3 points for snakebite, because snakebite was really a indigenous problem in the rice paddies. There's a lot of snakes that live in the rice paddies, and if you're not careful, you're going to get snake bit. So they would treat it that way. Here in the West, we do not treat it that way. We always go to the hospital. It's an emergency 911 to get the antivenom. Do not rely on acupuncture to fix this problem. This brings us to Dew 11. Dew 11 is T5. It tonifies the heart and the lungs, calms the spirit, clears heat, and pacifies wind. This is a really good point for anxiety and palpitations. This weird anxiety that everyone has right now, because they're being self-isolated or sheltering in place, This is one of the major points that I use in practice to alleviate that low-grade anxiety. Do 12. Do 12 is T3. It clears heat from the lungs and heart, calms the spirit, and pacifies wind. So, of course, it does this whole cough and asthma thing, but then there's this skin condition called furuncles. Furuncles are a close relation to boils. You could actually use this point because of its functionality of clearing heat from the lung. You could actually clear the furuncles. Do 13, the way of happiness. It is T1. It clears heat and treats malaria. It regulates the Dumai. Okay, so anything with a heat condition like febrile disease, which is all about fevers, or malaria, this is your one of your go-to points. Regulates the Dumai. Okay, if there's a block somewhere in the spine, you're going to have to think about regulating it. So if there's a physical block, scar tissue or something else, it's going to impede the free flow of qi and blood in the area, particularly within the meridian itself, which means you need to regulate it to make sure that flow isn't being dammed up because of that physical barrier. So you got to regulate the flow of qi and blood. So whenever you see regulates, that's what we're implying. Okay? Do 14, the great hammer. That is C7. Expels wind and firms up the exterior, clears heat, treats malaria, tonifies deficiency, and pacifies wind. This is one of your strongest points, to treat and expel wind and firm up the exterior. And what that implies is there's gaps in the Wei Qi. The Wei Qi is so deficient, there's little gaps, which means it's very easy for that wind strike to come in to the body, which means we have to firm up the exterior. We have to fill in the gaps. We have to boost the Wei Qi to make that firm. That's what that phrase means. Okay? Do 15, Mutes Gate. It is on the midline of the nape of the neck in the depression 0.5 Sun inferior from Do 16 below the spinous process of C1. Guess what it does? This is an added in slide that Uzi was kind enough to provide. It benefits the tongue and treats muteness. Eliminates wind, benefits the neck and spine. This is the #1 point for sudden hoarseness of voice, apocalypse, which is speciousness, or stiffness of the tongue, and aphasia, which is the direct result from a heart attack, or a TIA, transischemic attack, heart attack. This is the #1 thing to treat that, to get that voice back. Hence the name Mutes Gate. Do 16. Do 16 is in the depression immediately below the external occiput protuberance, EOP. Those are just some reference slides there for you. Eliminates wind, nourishes the sea of marrow, and benefits the head and neck, calms the spirit. Nourishes the sea of marrow means it nourishes the brain tissue. That's what we call in Chinese medicine the sea of marrow. It's brain tissue, which means it's good for post-stroke, aphasia, hemiplegia disorders. It's really good for that stuff. So this is the feedback loop, Do 16 to Do 20. There's 6 Sun divided by 4, which equals 1.5 Sun. So this is that whole feedback loop. Brain's door, Do 17. At the midline, in the back of the head, 1.5 Sun directly above Do 16, in depression directly superior or above the EOP. Eliminates wind and alleviates pain, benefits the eyes, calms the spirit. Do 18, which is 1.5 Sun directly above Do 17. pacifies wind, alleviates pain, calms the spirit. It's one of your go-to points for blurred vision, by the way. It's also a really good point for mania. But it's really hard to needle someone's head if they're being crazy and running around and being all mania. So take it with a grain of salt, please. Do 19. Do 19 is 1.5 soon directly superior to Do 18 and 1.5 soon posterior to Do 20. Do 16 eliminates wind, alleviates pain, calms the spirit. Again, the same indications as 18 and 17. Then the big one, Do 20. At the vertex of the line, in the midline, in the depression, 7 soon posterior to the anterior hairline and 7 soon superior to the posterior hairline. I guarantee someone's going to ask this question. Hint, hint, hint. It pacifies wind and subdues yang. It raises yang and counters prolapse. Benefits the head and sense organs. It nurses the sea of marrow, benefits the brain, and calms the spirit. It is the number one point to bring someone out of a coma. It's the number one point for the prolapse of the rectum and the uterus. And it's actually one of the major points, if not the number one point, for aphasia due to a heart attack or hypoxia. It's a very large point, by the way. It's about it has the same diameter as a nickel, actually. Do 21 is 1.5 soon directly anterior to Do 20. Eliminates wind and treats convulsions. Benefits the head. It's one of your go-to points for epilepsy and dizziness. And also a vertical headache. Or a vertex headache right here on the top of the crown. Do 22 is too soon posterior to the anterior hairline. So now we're going the other way. Everything up until this point is coming from the back of the head. This way we're measuring from the hairline. Benefits the nose, eliminates wind, and benefits the head. Do 23 is 1 soon posterior to the anterior hairline. Benefits the nose and eyes, eliminates wind, benefits the head and face, dispels swelling, and calms the spirit. It's one of your go-tos for any kind of nose congestion, rhinorrhea, anything like that. It's one of your go-tos. You could also do headache, anything involving the eye, and mental or shin disorders. Do 24 is 0.5 soon, posterior to the anterior hairline. Benefits the brain and calms the spirit. It eliminates wind and benefits the head, and it benefits the nose and eyes. Another go-to point for calming the spirit and benefit the nose. Then we get to 25. 25 is literally the tip of the nose. Guess what it does? It benefits the nose. It does something other than that, which is it is the hangover point. If someone is drunk and acting out and you don't want to be around them, you can actually insert the needle and it kills the alcohol intoxication. That's why it's referred to as the hangover point. And tomorrow I'll actually tell you the story behind that. It also treats something random such as rosacea, which is a type of skin problem. 26 is above the upper lip at the midline at the junction of the upper third and lower 2/3 of the philtrum. This whole little spot right here. It restores consciousness and calms the spirit. It benefits the face and nose and expels wind. And it benefits the spine to treat acute lumbar strain. It's actually one of the number one points to treat a deviation in the mouth and eyes and puffiness of the face, pain and stiffness of the low back because of its ability to treat acute lumbar sprain. Okay. Do 27. On the midline at the junction of the margin of the upper lip and the philtrum. So this is the lower part right here. Clears heat, generates fluids, and benefits the mouth and calms the spirit. That's all it does. And then finally, 28. 28 is inside the mouth in the superior philtrum at the junction of the upper lip and gums. Guess what it does? Clears heat and benefits the gums, benefits the nose and eyes. I've only done this a couple times in practice, and after I've done it, I will never do it again because I do not want to stick my fingers in somebody's mouth. Just don't want to do it. I don't know how you guys feel about it, but I can find other ways to benefit the gums than sticking my fingers in someone's mouth. Just saying. Okay, and I think that's the end of the lecture. I don't think there's anything after this slide. Let me just double check. That's just for your own reference. It gives you a visual on comparison points. And that's something that you guys can review on your own. Okay, so I will see you all tomorrow in class.